Welcome. This is Conversations with Black Doctors, brought to you by Austin Black Physicians Association, also known as ABPA. The mission of the Austin Black Physician Association is to improve health disparities within our community and to inspire and nurture the next generation of Black doctors. The purpose of these webinars is to bring health information to our community from trusted voices in the Austin area. We want everyone to have the knowledge to care for themselves in the best ways possible. If you're interested in learning more about or collaborating with ABPA, please visit austinbpa.com. That's austinbpa.com. And please feel free to share.
Welcome to another episode of Conversations with a Black Doctor. Thank you for joining us. And with us today, we have two fantastic pediatricians. Dr. Efuribe and Dr. Holliman are both joining us today for part two of our discussion about going back to school. For those who may not have seen the last one, would you both introduce yourselves again? So we'll start with you, Dr. Efuribe. You're on mute.
That always happens. Hi, I'm Chinwe Efuribe. I'm a pediatric physician and adolescent medicine specialist.
Great. And Dr. Holliman?
Good afternoon. I'm Liz Holliman. I've worked with Austin Regional Clinic and I'm a community pediatrician.
Perfect. As we get into this conversation, I want to make sure families and parents, anyone who's watching this, knows that we all agree that parents want to do what's best for their kids. That's not a question. We know as parents, as people who take care of children, that parents come in all the time who are worried, who have questions, but the common denominator, the common factor is that every single parent wants to do what's best for their kid. This last year and a half has been difficult, to say the least. There have been a lot of challenges, a lot of things that parents just don't know, not sure which messages to believe. So we're offering a voice today from people who studied medicine, who care about children, and how to best transition back to school, whatever form that may be. So let me start with this first question. There are children who are anxious. I have a 17-year-old rising senior who is worried about whether other people have been vaccinated and whether it's safe to go back to school. I know parents of kids that are younger, parents of kids of all different groups are worried about what school is going to be like. Dr. Holliman, let me start with you and ask, what do you tell parents who share with you their worry about their children being anxious about going to school?
First of all, I tell them that that's normal. We're going through a pandemic right now and kids are anxious and adults are anxious and sometimes even pediatricians have been anxious going through all of this. So kind of reaffirming that what they're feeling is normal and appropriate for what we're going through can kind of settle some of the nerves. And then I just kind of discuss with them the risk and the benefits of going back to school. And really the benefits are outweighing the risks. So we know that the school is beneficial for academics. We know that school being in person is beneficial for the socialness that kids need. They learn how to be friends, they learn how to share, they learn how to take turns. You really don't have to do that much when you're living virtually at home. And then also the emotional part of it as well. So there's different and several aspects that are so much beneficial to being in person and in school learning. I don't know if you're going to ask later about the risk. Yes, there's COVID risk, but we just have so many studies that show masking helps. And if you can be vaccinated and the parents being vaccinated to protect the younger kids, that's going to lower our risk, which we saw that was just really, really low transmission of in-school COVID cases.
Thank you, Dr. Holliman. You had a lot of great points. You're exactly right. Risk and benefits are something that every parent has to weigh, every person has to weigh. And the AAP has recommended in-person learning is the best when possible, and also wearing their mask and getting vaccinated. Dr. Efuribe, do you have anything else to add to talk to parents and especially teenagers that might be anxious about going back to school?
Yeah, definitely agree with Dr. Holliman. Um, there are a lot of things to be on alert about. And I think when it comes to anxiety, I always kind of use the analogy in sports. It's like being on offense, you're trying to, make a play and hit and go different directions and trying to, find what path you can take. But with defense, you only have one post that you're guarding, right? You only have one little area that you have to just make sure that it's secure. And so when you transfer that to health, I feel like I try to encourage them to think about, well, what do you have control over? You can't control how the politics kind of play out, whether the governor is going to support or ban mask mandates in your school district, right? You can't control that. You can't control the people around you, whether they're going to wear their mask or not. You can't, there's so many things that you can't control. But what I try to find from their own perspective is like, what do you have control over? Is it making sure that you're sleeping well? Is it making sure that you're eating a healthy, balanced diet as best as you can? Is it making sure that you have different coping skills? Breathing, because there's so many things that we can be anxious for, but there's a small amount of stuff that are within our I guess autonomy, that makes you feel like, at least if I can check these boxes that I know only I can do, then it allows me to be more prepared to be able to, approach anything that comes my way, right? So hopefully sometimes it does help them kind of build that resiliency to feel like, okay, yeah, there's so many things I can't plan for, but this I know I can plan for, and I can kind of protect my health in that way and protect the immune system. Because that's another thing that we're finding is that, yes, there's COVID vaccine, and we definitely encourage everyone to get the COVID vaccine who's eligible to get it. But there are also different things that you can do to build your own natural immunity. And it really goes to our habits and our behaviors. But that's one thing I would add.
That's fantastic. And I really appreciate you mentioning the fact and emphasizing stress has a lot to do with things we can't control. And we decrease that stress by finding the things that we can control and taking advantage of that. Good. So we talked about our immune system. Before we get into other ways of building our immune system and just living healthier, which is something that we always want to talk about, let's talk a little bit about when there's a disconnect between the parent and the 12-year and older who want to get a vaccine. Either the parent wants it and the teen doesn't, or the teen wants it and the parent doesn't want them to get it. Do you have any recommendations, Dr. Efuribe, about what you talk to families in those situations?
Yes, I feel like this is my day-to-day work in adolescent medicine, where we're always trying to mediate negotiations between adults and young patients. And I'm sure, Dr. Holliman, you have some patients in that range that is trying to figure out what the parent wants and what the youth wants, and how to find a happy medium for them to, one, communicate their needs, and then move towards a plan. And that plan doesn't have to be something that's definite. It's just a plan at this moment. So I know I think I had today, it was kind of ambivalent, but the mom was adamant that the child was not going to get the COVID vaccine. But the youth was a bit ambivalent. She was like, yeah, I mean, I'm not necessarily for it, but I'm not necessarily against it either. But the mom was like, nope. It was, all these different barriers and concerns that she had about the vaccine. And so what I tried to encourage was, one, being able to acknowledge each other's perspectives. I think that's the first thing. Sometimes it's hard to move towards a decision if one person feels that the other is not hearing them, and vice versa. So I always encourage there to be an open understanding to hear the other person's perspective, to hear their rationale, to hear, well, what's behind that thought? What experience have you had that brought you to that conclusion? And unfortunately or fortunately, depends on the age of the patient. To what extent are they minors that truly don't have any ability to consent for vaccines on their own, versus whether they're of legal age, or to make some decisions of consent. So, but for the young person, for example, who really wants to get the vaccine and they're a minor, but their parent doesn't necessarily want them to get it, one, I think it's just understanding where the parent is coming from, that the parent is really just considering the risk and the benefits of what the vaccine entails. I try to provide information for the mom or the parent or the caregiver so that they have accurate information. Sometimes it's just about, how much information they know and what feeds into their health beliefs.
Great. Dr. Holliman, have you had other success or advice you want to give when you're talking about vaccine hesitancy or curiosity in families?
Yes, almost every day, unfortunately. Um, I've actually had two cases that kind of caught me by surprise. One was a family that I've taken care of for years, and the dad wanted the patient to have the vaccine, and it was a 17-year-old, and the mom was adamant that she didn't want the child to have the vaccine, and the child spends the majority of time with the mom, but the dad brought the patient in, so he was actually willing to say, I'm going to give him the shot, even though the patient was like, no, mom's going to be mad, and kind of, no, I don't think that's a good idea. So what I did was I said, let's call the mom, let's call her, and let me just hear what she has to say. Let me hear what her concerns are. Because I think a lot of times if you just kind of say, what are your concerns? What's going on? Why do you feel this? Then you can better talk to someone. If you just kind of go in straight and say, this is why you need it, these are the benefits, then it's that wall that's put up versus let me hear why you're saying this. And ultimately, I want to have trust with the entire family. So I said, hey, we don't have to make a decision today. I talked about the time length that's needed to have protection, and he played sports, so I wanted to give him protection because I know the mask is not going to be on during the sporting activities. So at least I felt like they listened, and if they changed their mind, then that's great. And if not, I did give them other ways to keep themselves safe, like the masking and the not being in large groups. I also had another patient that came in, I think I said good morning, and they said, we're not getting the vaccine. And I was like, okay, let's go on to the next thing. And then she said, we just decided as a family, we're not going to do that. I was like, that's fine. And then she said, but what do you think? And I was like, okay, so I think they have, sometimes parents have all this built up energy, and it can be because of politics. But then when they do come in, and I'm glad I have the job that I get to, be with families from birth, that the babies can do nothing until when they're going off to college, and they can make decisions on what they're going to become in life, because then there is that trust built in me. And we ultimately got the child to get vaccinated, and the mom said, you know what, I'll get it with you, we'll get it done together. So it was not what I was expecting at all, but I think it's about having that relationship with your pediatrician, and they want to know what we think. And so as pediatricians, we always have to have that open mind, and there's no right or wrong. We've said that from the beginning. Parents are doing what they think is best for their child. So I, kind of reiterate, I'm behind you 100%. I'm holding your hand in this journey, but if you're coming to me, I'm going to give you the evidence-based medicine.
That's beautiful. You said exactly one thing that I emphasize all the time, that it's a relationship, right? So when a parent comes to us and they've known us and they know we want to help their child, it's much easier to give them information that they know is not coming from politics, not coming from any other motive other than we want to do what's best for them. A few people said this: if you trust us to come and let us take care of you, then you know that we wouldn't do anything that would harm you willingly. Now, there's the risk and benefits of everything, but we're going to have that conversation. And the way that's worked for me a lot of times with these families is letting them know, one, that I and all my family have gotten the immunization, and that I really do want to do what's best for them. But just like you said, we aren't going to force anyone to do anything that they're not ready to do. So thank you both for that. Let me go now to what a lot of parents worry about with school. And again, this last year, that their children may have lost something, either socially, academically, being at home on the computer, trying to learn. It's really not the same as being in person. And there's some parents who come to us as health professionals and wonder, well, what do I do, or what can I do for my child who may have fallen behind either academically or socially, or they just may not be as ready for school as I'd like them to be. Do you hear that, or do you give any advice for that? And I'll start again with you, Dr. Holliman. Do you talk to families about this last year and what to expect going forward?
I do. And a lot of times parents already know, so they'll bring it up to me before I even have the opportunity to address it. And I kind of reaffirm them that yes, the state results from testing have shown that the kids have had some lagging behind academically, but I let them know, hey, the teachers are in this for the long run, and it's not just your child, it's the whole group that have had some setbacks. Now, I do have a few that have excelled in the online learning, but I have to, tell them, hey, we're going back to what we used to be. Remember how they've gone to school since kindergarten in person. So they're gonna adjust, they'll get back to where they need. A lot of the school systems have offered like summer schools, and some kids took advantage of that even if they didn't need it, but it was just to kind of get them back in the pace for going back to school, and just letting them know it's a marathon, it's not a sprint. We don't have to be a certain place by the beginning of school starting. So, keep in contact with your teachers. If you're seeing more lagging that's not catching up, always have that communication with your teacher, with your child's teachers as well.
Excellent. Dr. Efuribe, do you have anything else that you tell families who are worried about what it may have been lost over this last pandemic?
Yeah, I concur that there are a lot of other students who are also trying to catch up. And I think all school districts are expecting that and are putting measures in place to be able to provide some accommodations. I think it does help for caregivers to be active in that process, as the students are being, provided with accommodations, giving some feedback to the teachers to say, okay, well, this extra work at home, this is how, I'm noticing whether it's homework or keeping up with their assignments, how their grades are doing, so that if there's any further delays during the new school year, then at least the teachers can be a little bit early in intervening. I think there are also a lot of online and community services and nonprofit organizations that are offering, whether it's free or low cost tutorial services. So I think it's one of those things to just, whether you need to Google or look online, even in the library, there are certain offers to be able to help some students, be able to catch up. But yes, we're all in the boat together, and it's going to take some teamwork.
Excellent. That's great points, both of you. Dr. Holliman, you mentioned earlier about improving our immune system and things that kids and everyone can do to stay healthier. I feel like you want to say more about that. Can you share what your thoughts are about that?
Of course, the things that we always say, eating plenty of fruits and vegetables, getting water, getting fresh air, getting outside. With the online learning, it was a lot of just, I'm sitting at the computer inside all day, and then I have anxiety. And so then I'm sitting inside because of my anxiousness. So nobody got outside. So I think fresh air and vitamin D are like the happy hormones. So getting outside for that 1 hour physical activity every day, that's going to boost your mentality. That's going to boost your emotional health, your physical health, and just being of healthy mind and body is always going to help against any kind of physical illness as well.
Excellent. Dr. Efuribe, this is sports physical season too. Do you have any extra advice or thoughts to parents about getting ready to go back into the sports for school?
Trying to think of anything additional, not necessarily. I know there's always sports performance. I don't know if you guys are keeping up with the Olympics and how the mind and body are truly connected. And I don't want anyone who's in sports to forget that it's okay to slow your pace if you're managing things related to your mental health. Sometimes, it's a fine balance between trying to kind of do the tough love and go against your body, what your body's telling you throughout, physically especially. They say no pain, no gain, right? And so I think it's sometimes the messages can be mixed as to how much pressure is enough pressure for you to kind of overcome and excel and do beyond what you may expect yourself to do, versus when that balance is kind of tipped over to the point that you could put yourself at risk or cause harm to yourself. And so I think if our Olympians have taught us anything, is really listening to your body, listening to your mind, not giving into external pressures that may go against your own intuition. I tell my teens, you are the expert of your body. I may give you recommendations of what we know about most young people your age, but you are the expert of your own body, and there's no other body like yours. And so it's just one of those things where, especially athletes, we want you to be safe. At the end of the day, it's about your safety, but also, lean into the people around you that are able to kind of feed into your thriving.
Thank you for bringing up the Olympics. That is really important because we've had some wonderful examples of people putting their mental health and their safety above the Olympic achievement. And those people did it at a great risk. And athletes, anyone who is an athlete knows that there is that constant pressure to perform. And sometimes it's hard to take care of yourself. But pressure and performance, stress and performance is in what we call an inverted U curve, meaning that there's not much stress, you don't perform very well. And if there's too much stress, you don't perform very well. Finding that right amount of stress is what a good coach, a good team, a good athlete constantly strives for. So thank you both for sharing that. All right, so as we get close to wrapping this up, can either of you share resources that parents might need to be aware of to help prepare their kids for going back to school? Dr. Efuribe, let's start with you. Any resources that you know of that you think parents could benefit from looking at?
Sure. I'll give my own personal experience as an example. I have a 6-year-old with special needs, and I remember trying to get him prepared to wear his mask consistently, because I think that's one of the main concerns. Like, well, how am I going to get my young kids, to keep their mask on, to wear it? And so, again, this is not necessarily scientific, but I believe having some practical measures that are tested in behavioral health theories, are really, helpful. So there's a YouTube video that's entitled "How to Get Your Toddler to Wear a Mask." And there's a young woman that really goes through really behavioral theory principles about motivational interviewing. And the first is, one for, especially for young kids who are, in school age, kindergarten, first grade, second grade, is one, helping them understand the why if they can. Because sometimes even my son, he wants to go to Afghanistan. And I said, well, we're in the pandemic. He said, well, we can wear our mask. If we wear our mask, we can go. So helping them understand the rationale and the why and about helping us stay safe, it's important to share. No matter how young they are, you'd be surprised how much they can actually grasp. Second, helping them find something fun about it. Because, just wearing a mask can be daunting for young people, but colorful masks make it more appealing, and allowing them to choose the mask, give them some autonomy to say, oh yeah, I picked this. And that really builds into their ability to be more compliant and to wear it, because it's like, it's theirs. And then second is routine. I think it's the Paslow's kind of conditioning experiment kind of tells us the more you kind of do something, the more it's ingrained in their structure and in their habits. And so finding, even before school starts, because I'm not sure how soon school's gonna start for some people, but maybe a week before, 2 weeks before, whether it's small trips to the store or small trips, just even going outside, helping them get used to wearing the mask over an incremental time, so that they can get used to being able to wear it all day in the classroom. And then I think the last one is rewards. So if they're able to kind of get to all those different stages and are able to kind of, increase their ability to wear the mask on a consistent basis, helping them find a way to stay committed to doing it, especially, when they're going to get to school. It's like, okay, if you did it for 10 minutes, you get this treat. Now, no candies, because we're trying to decrease obesity and other things, and teeth, but treats that, one, are affordable, but also are healthy, but something that the young person wants. Even adults, like, we don't go to work without pay. Like, there are certain things that, allow us to continue a certain behavior. And so if you can add that to them to get used to it, to have some positive reinforcement, that increases their ability to kind of stay with the mask. So I think if we have more young people wearing their masks in the school, it can help decrease some of the anxiety that people are feeling, that other kids aren't going to have their mask on and they're going to be touching on other kids. So I think that is something to consider. But it's a YouTube video, how to help your toddler wear their mask. It's had like 10,000 views. But I found the recommendations to be evidence-based and match behavioral theory principles.
Perfect, thank you. Dr. Holliman, any recommendations for resources?
Always American Academy of Pediatric.org and CDC.org. But one of the things I went to an event and it was a mental health, and it was talking about different apps. So the kids now love apps. There's apps for everything. I learn every day there's an app for counting pee-pee diapers and poo-poo diapers. Like there's an app for everything. But there's an app, like a mental health app that helps to just like relax or take deep breaths or soft sounds. And sometimes we just need to hear that when we're kind of anxiety up to here and we just need a minute, to kind of let me just calm down somewhat. Those are numerous on your smartphone, and there's plenty of free ones so that you don't have to pay for anything. So that's a big one that I recommend. And also, like Dr. Efuribe discussed, practicing wearing a mask before school starts. So I have them start like a week or two wearing the mask all day at home, just because that learning curve is so high when you first have to start wearing it all day. And my kids have been, my patients, I call them my kids, they're my patients, they have been phenomenal with mask wearing. They're better than their parents. They're better than the adults. When we first started this, we were like, oh, 4-year-olds won't do this. Oh, kindergartners won't do this. And they do it far better than the adults, and much better. And I think they just always rise to the occasions. Kids are doing great with this. I'm so proud of them. And they're just great people. So I'm proud of them. I know they can do it. And we will get through this.
Thank you both so much, Dr. Efuribe, Dr. Holliman. You both are fantastic, and the Austin community is lucky to have you as pediatricians here. Thank you so much. For all of those who are interested in contacting the Austin Black Physicians Association, please write to us. Send us your suggestions, send us your thoughts, send us your questions at info@austinbpa.com. That's info@austinbpa.com. Right, thank you both.
Thank you.
Thank you.